You're first. You can go back one slide, Boswell. There you go. That's Stella.
Hello, hello, everyone. We're just going to let folks take a minute or two to gather in this space. We are very excited to be here with our amazing speakers. So we will just give it probably another minute or two for folks to come on in. And while you're waiting, if you want to head over to civichealthalliance.org, we have a lot of resources over there. You can also point your phone to this QR code over here just to double check, triple check, even though the elections are over, that you're registered to vote. Welcome, welcome. As folks are joining us, you are in the right space. This is Civic Health Alliance's So You Voted, Now What? Essentially, after the midterms are done, we are so excited to have you here with us. I think we can go ahead and get started now. We have amazing panelists, so we just want to spend every second that we can with them. My name is Dr. Stella Sappho. I'm one of the 4 original co-founders of Civic Health Alliance, along with Dr. Manisha Sharma, Dr. Ali Khan, and Dr. Sanya Lair. And we formed Civic Health Alliance back in the day when it was Vote Help 2020, during the height of the COVID-19 pandemic, when we saw that our patients and our peers were struggling to get out and vote in the 2020 elections. And we did this by creating materials and a community to really support each other in getting out the vote. We have expanded to Civic Health Alliance, and our goal with Civic Health Alliance is to really embed civic engagement into the culture of medicine. We've been having a series of conversations with you all in different webinars and different grand rounds and all kinds of spaces. And this is really a conversation that'll be moderated by members of our team around, so we voted, what comes next? And so with that opening, I'm going to turn it over to Russia Chavez Cardenas. I think you're on mute, Russia.
Trying to cut out the background noise. Hi, all. Russia Chavez Cardenas. I'm the Director of Strategy and Partnerships with Civic Health Alliance. Thank you all for being here and welcome. Just a couple of housekeeping rules. We're going to be active in the chat this evening. And so if you have questions in there, feel free to ping them. We'll have an open question and answer period towards the end. We want this to be really conversational. So if you have something that you want to post in the chat, and we'll be using it as well. So we'll be keeping an eye on that. And then you can also reach out to the folks on the panel. As Civic Health Alliance is why we're thinking about why we want to be here this evening. First and foremost, we are a nonpartisan organization, a coalition that is really focused on advancing America's health through civic engagement. So as Stella was mentioning, the midterms have happened and people have worked so hard to get the candidates elected that they think can best represent them. I think we have a couple of slides that show how hard folks have worked. A couple of our physicians, and partners of what we do here at Civic Health Alliance. But unfortunately, after this effort, this is also when people tend to look away from civic engagement. However, at Civic Health Alliance, civic participation occurs year-long for us. And we define civic engagement as encompassing the variety of ways individuals and groups participate in their communities and public life. Next slide, please. In service of addressing issues of public concern and or improving community conditions. We see civic engagement as a continuum. It can be as early as voting and then moving all the way along the lines of becoming an elected official. And then there's other buckets within civic engagement. Some are related to voting, some are related to public comment, sitting on the dais with elected officials, meeting with elected officials, serving as a task force member of your community task force or a community organization that you're working with. So As part of that, we see that there's an element of storytelling and sharing our stories with elected officials and government officials and decision makers that is key and important. And that's what we want to talk about here. We voted. How do we engage next with this body of individuals? And as healthcare professionals, researchers, clinicians, administrators, and others, you have stories that are particular to you, that are based off of your lived experience and your subject matter expertise. And at Civic Health Alliance, we want to help facilitate your continued participation in the public policy process. To help us do this, today we'll be joined by an elected official and physician advocates and a former legislative staffer and lobbyist to discuss what types of advocacy works and what doesn't.
It is my honor to introduce these four amazing speakers. So first off, in no particular order, we have Dr. Monica Verduzco-Gutierrez, who is an accomplished academic physiatrist and professor and distinguished chair of the Department of Rehabilitation Medicine at the Long School of Medicine at the University of Texas Health Sciences Center in San Antonio. She has over 100 publications in these areas, as well as topics related to health equity and inclusion. She's also a sub-investigator in the NIH Recover trial through her institution, which is one of 17 hubs in the country to be a part of an initiative to study long COVID. Next is Alchemy Graham. She joined the Share Yoder Atwin, Schmelmer, and Lang team, in 2021 as a legislative and regulatory advocate after serving as an assembly fellow in the Assembly Members Bennett's office, where she staffed the member of the Budgets Committee 3 and Water, Parks, and Wildlife Committee. Currently, Alchemy is the chair of the California Legislative Black Staff Association and events director for California LGBTQ+ Association. Next is Dr. Mark Shapiro. He is a practicing hospitalist and is the creator, producer, and host of Explore the Space podcast, a show focused on bringing those who provide healthcare and those who seek healthcare closer together through conversations with leaders from across the spectrum. And then last but not least, we have Senator Erica Geis. She is in her first term as a state senator representing District 6 in Michigan and currently sits on the Senate Standing Committee of Economic and Business Development, Education, Insurance, Banking, and Transportation and Infrastructure, of which the latter two, she is the Democratic Vice Chair. Geis is also the Senate Democrat Caucus Chair, Executive Vice Chair of the Michigan Legislative Black Caucus, Co-Chair of the Michigan Environmental Justice Caucus, and a member of the Michigan Legislative Latino Caucus.
Jessica, thank you for introducing our wonderful speakers. So to get things started, I just want to do some grounding and orienting with everyone. I'll start with you, Mark. And I want to ask if you can share briefly with us in a few words, what brings you to this work?
It's an absolute treat to be here. This is very exciting. Some of the folks on the panel I know, some I've been able to learn about over the last couple of weeks as we've been putting this together. And this is very, very exciting. You know, for me, civic engagement is something that I was steeped in growing up, something that my parents felt like was very important. It was something that was important in, elementary school and onwards, and all the way through college until I got to medical school. And then in medical school, what I heard and saw role modeled and received feedback around is that this is actually not something that physicians should be engaging in, that civic work is seen as political, it can be seen as unprofessional, it can be seen as a wide variety of things that can distract you from direct patient care and from the care of the community that you're a part of. And that was messaging that existed before I came into the profession and has persisted. As the years have gone by, as my career has evolved, and as I've become active with my podcast, Explore the Space, and been active on social media, I've had the opportunity to learn from a lot of people who are much smarter than I am and are far more courageous than I am to help me understand that messaging that I received is extraordinarily outdated, inaccurate, and ineffective. And so in that space, being able to understand the professional responsibilities that I have, but also as a physician who is also a white man, the privilege that I carry, that there's responsibility that comes with that. And reigniting the passion that I had for civic engagement prior to medical school and bringing it into my professional work has been extraordinarily exciting. And getting to do things like this, right? This is the arc of my career now, and I absolutely love it.
Oh, thank you, Mark. I'm gonna popcorn it over to Alchemy.
Yeah, thank you. First of all, thank you for having me. This is really exciting. I would say what brings me to this work, this is one of my favorite stories to tell. Anybody that knows me will know that I will shout this from the rooftops, but I was in Girl Scouts for 10 years. And during that time, we spent a lot of time just outside, enjoying the nature and just the environment and what it had to offer. And I think that's where I started becoming more of an environmentalist and working as a transit lobbyist and a transportation lobbyist. I spend a lot of my work focusing on environmental issues, as transportation go hand in hand with environmental issues. And before I became a lobbyist, I didn't quite know what I wanted to do with my love for the environment, but I learned that a lot of power is in speaking effectively and efficiently to government officials, because those are the people that are going to make that change. And so that's kind of how I ended up where I am now as a lobbyist. I learned that there's a lot of change that I can make in this position. That's how I'm here.
Oh, wow. Thank you. I really like that rich story. Senator Geis.
Thank you so much. And both Alchemy and Mark, those were fantastic stories. I'm so grateful and proud to be here tonight, especially since, yes, we have made it through the midterms and the Michigan legislature ended last night for this term. So this is fantastic. In terms of what brings me to this work, I decided to run for office unusually. I do not have a degree in poli-sci or government or anything like that. My degree is in art and architectural history. And I also have taught on the university level, and there was an education issue that was affecting my district. In Michigan, we have term limits. And I was one of the people who's very connected to knowing what the issues were. So I was very concerned that when the person who was termed out, who happened to be my husband at the time, well, he's still my husband. At the time, he was the state rep who was termed out, that who would know what was going on if these issues persisted. So I decided to run. But the idea of civic engagement has been infused in me from I was little. As a second generation American, very proud immigrant grandparents. I remember being little and going with them to vote and being told to stop playing with the curtain when I was like 3 or 4. And, my grandparents were friends with Congresswoman Shirley Chisholm, and who was I was born in New York. And so the idea of political conversations and politics being personal and the personal being political was something that I guess was infused in my blood and in my psyche. And I did sort of activisty things in university. I went to Brandeis University for my alma mater, my undergraduate alma mater, but never saw myself as running for office until there was something that directly impacted my community, and had the opportunity, jumped in with both feet. And here I am 8 years later, about to go into my final term in the legislature.
That's a phenomenal story. Thank you for sharing. And last but definitely not least, I'll kick it over to you, Dr. Verduzco-Gutierrez.
So I have a similar story where it's like when I was young and remember going with my mom to go vote. And I think that's a really transformative, and it's so important. So it's something that I really made sure to take my children to when they were younger to go vote with me, made sure they wear their sticker, just show them this is how you start to engage in your community and make a difference. And then of course, going into medicine and wanting to make a difference in patients' lives, and just realizing, when I see a patient, I can make a difference of one person at a time. And of course, it's so important for that person who's in front of me. But what about for all the other people who may be suffering with a disease, or who may be, dealing with certain issues? And there's certain ways to deal with it at bigger levels. Sometimes maybe you can do research and find a cure for something. And, I do dabble in research, but then another way is being a voice and, doing advocacy work. And then you we have the expertise, we have the knowledge, and bringing this knowledge that's needed to help our legislators, our Congress people, so that they can know what's really happening and then put that into action and help the people at a bigger level.
Ooh, thank you guys. I have a small child who voted with us this year. So I like these civic engagement stories. And she was so proud to wear that sticker, I tell you. So could one or two of you share some effective ways you've seen people communicate with elected officials?
I can go ahead and kick that off. I will say, so this is coming from my experience as a staffer in the legislature. I think one way that I found was especially helpful when communicating with legislators is personalization. You know, elected members, they're elected to represent their jurisdiction, whether, you know, whatever city, counties are included in that jurisdiction, they're elected to represent the constituents in that jurisdiction. And I felt that the most effective and the most, I guess, emotional, for lack of a better term, meetings that we had were ones where constituents were coming from the district, you know, physically in person, or whether it was via Zoom over the lockdown, but they came with their own personal stories of how certain policies would affect them and how it might affect their business, how it might affect their family or their loved ones. And those were the most impactful ones, because you can see that these are real people and that these are going to have real changes. It's a little bit different when it's, you know, I mean, there's nothing wrong with, you know, petition signing or I guess crowdfunding on like internet sources, but there is something that's especially special when it comes to speaking with your elected official and having that connection. I would also say show up. I think somebody might have mentioned earlier showing up in committee, testifying in committee, submitting support or opposition letters to really make your voice publicly known in like the public record, the bill analysis. That's especially helpful because it shows that you're there, your voice is heard, and you're being represented.
Thank you. Does anybody else have one?
Yes, I think kind of aligned with that is you have to know what's important to them and bring them, you know, the story that's going to be important to them. So if there's someone there, you know, there's a lot of veterans in their district, or they are vet themselves and they really care about vet issues, then you have to say, like, how does this issue that you care about impact that group that is so important to them? And if they see it as aligning with their views, then they're going to want to learn more about it and they're going to want to support it. So that's just something else to add that kind of aligns with what was already said by Alchemy.
Oh, thank you. Senator Geis.
Yeah, those personal stories are so important and critical. The form letters are great, and you know, often you'll have an organization, you know, say submit this for or against something. But when I will tell you that our staff receives a lot of those. When the added personalization to whatever is in that sort of boilerplate language is included, it really resonates, because, and it's human nature. You see the same text over and over again, and you kind of, it starts to get tuned out. And I think that is true for every human. But those personal stories really, and how it's directly linked to whatever that policy is or whatever that bill is that is being introduced or argued, and the earlier, the better. So in Michigan, and I'm sure all the other states have this, the other 49 states and the District of Columbia have this, where you can see everything that we do. So for us in Michigan, it's legislature.mi.gov. Right now, it's not going to do much because we just finished session last night. But once you know what bill numbers are, you can plug it in and you can follow the legislation from the moment it has a bill number, waiting until it's on the floor for us to vote on, versus before, when it's in committee or when we're amending language and updating it. That's when it's most effective to get in there and talk about why and how legislation can be better or not at all, because there's some stuff that just shouldn't be introduced. And I think that is really personal. And I love it when, you know, it's a casual conversation at the market. I'm a mom or after a band concert with another parent. Those moments when we are very much ourselves in our communities as opposed to in our professional roles, are also impactful. I think that's something that when people remember that we're also members of the community, we're not just sitting in the dome where we work, just doing a job, that's also helpful. And when people are genuine versus combative, that's also really helpful too.
Thank you, Mark.
I think it's really important to remember, sort of hearing what you all have described, kind of the theme that I'm capturing is this is work for that kind of requires kinetic energy, right? This is not potential energy. We all have that, like we'll see the headline or we'll see the news or we'll see the policy that's being debated and we'll have emotions around it. We'll feel a certain way around it. It's really important in terms of communicating with elected officials is to really transition that potential energy to something that's kinetic. And I think now more than ever, remembering what is kinetic, right? The things that you all have listed, I would agree with all of those things. And I would just remind everyone too, that social media is not necessarily kinetic. It gives us the illusion of action, but I would suggest that most elected officials have a hard time distilling what is real and powerful from their district versus what is not. And so making sure that you're in the spaces that everyone has described is more important now than ever, because I think it stands out in juxtaposition very, very powerfully. There's nothing more powerful than being actually next to your congressperson. I mean, I've come to know my congressperson over the last couple of years simply by being there. And it can feel uncomfortable. Not everyone likes to necessarily be out in public or ask questions of an elected official, but stepping into that tension, I think, is critically important now more than ever to set yourself apart from the saturation that comes from all those other channels.
Mark, you just said something that you all said something that made me think about two things. And it touched on sharing that personal story, but from the seat of your lived subject matter expertise. And that story from what you're seeing on the ground, what you're feeling on the ground, and sharing that. Dr. Monica, can you tell us how because you've you've had to give your story very publicly on a lot of public spaces, in front of Congress. Can you tell us how you sit in that seat of the subject matter expert, but also in a very public setting?
Yeah. So like you said, I have the expert, I have the education, but it goes back to the storytelling and having the story to tell, that we have the power to, tell our legislators what's really happening that they might not hear, and make it understandable for the legislators, for the people that they work with. And I don't know, am I answering your question correctly?
You are.
Am I going the right way that you want?
You're going.
And so, I've had, because maybe I have a voice on social media, but I've done a lot of, research and publications, then my name is out there. So I've sometimes been reached out, the staffers reach out to me and they want to talk to me. They want to hear what I have to say about my experiences and about patients that I'm treating. And then when it aligns with, oh yeah, listen to what she's saying, that sounds really important. We're going to have a hearing. Will you please come and testify for our hearing? Then this is my chance to say, yes, I want to do this. There's, a lot to be said. And, there's a lot of steps we can go into later about what it takes to finally do that.
Thank you. You touched on the staffer piece. So I'm going to look at you, Alchemy. You've been a staffer on these committees. How have you And we know that staffers are the folks in the room who help dig really deep on the issue. They help the member understand the issue in a very deep way. I see Senator Geis nodding her head like, yes, that's what they do. They help them. And so from that seat of the staffer alchemy, um, how do you help the member shape that their policy agenda based off of what you're hearing and seeing from the individuals on the ground level?
That is a really good question. And I just want to say that the point of with people that are coming with that expertise and that experience and that knowledge, I can almost guarantee 99.9% of the time the staffer does not have that same knowledge. And so explaining things in layman's terms is so helpful, because we do have to go back and talk to the senator, to the assembly member, to the representative, whoever we're talking to, whoever we report to. We have to talk to them and explain why whatever it is that the bill is about is good or it's bad. And if we don't understand it, it's very complicated to explain. And I might be a little bit biased because I was a staffer as a fellow. And so, I had no building experience before that. But in the fellowship, that was one of the biggest things that I learned, was that if it's explained in a digestible way, that's really the best way to sort of communicate that information. And I feel like there's also a little bit more bias there too, because I graduated from UC Davis with a degree in biological sciences. And I think pretty widely known is science is just a complicated thing to explain to people, especially when you're explaining it to someone that doesn't know anything about it. But I'm getting a little bit besides the point. To answer your question, in terms of affecting the legislators', I guess, political agenda, I mean, that really is our job. We do have to know in a certain amount of the information that's given to us beforehand, before, we're lobbied on it. And we do have to be able to explain that pretty concisely, because at any given time, I remember that we would sit down in briefings with the member and we'd have maybe half an hour to go over like 120 bills. So, we do have, I think, a certain level of sway to an extent, because we do have that extra knowledge from the lobbyists, and also some knowledge from whatever background research that we've done, that chances are the member may not know themselves. And so I think that's really where that influence comes in, is that we have done that research and we can sort of influence, any particular ideals on a bill based on the research that we've done. So a lot of behind the scenes work.
I've spoken to a lot more staffers than I have to real members. And, I know that the information's being synthesized and getting to them.
I know that on our chat right now, there's a number of people in the audience who are healthcare professionals. And I think what Alchemy just said is critically important. And it brings up two really, really useful things for us to think about. Number one is that clarity of message, right? Our profession is steeped in jargon. I could give Monica a 90-second snapshot of something. She would know exactly what I'm talking about, and it would sound like a message from outer space to almost everybody else who hasn't had the same training that we've had. And incidentally, she actually went to the same medical school. But at the same time, it brings up a skill that we in medicine are not very good at, which is pitching people. The art of pitching someone and having a clear idea of what you want to convey, practicing it, being comfortable, confident, and ready when the moment comes, and then delivering effectively that 90-second elevator pitch. It's again, that juxtaposition, and that friction is a compelling one for our profession and for anyone in healthcare to move away from jargon, which is something we're very heavily steeped in, and get good at something that we're not heavily trained in, which is that idea of just how to pitch somebody effectively on an issue where we have a great deal of passion and more importantly, subject matter expertise.
Mm-hmm. Senator Geis, hop in there. I see you want to jump in.
Yeah, so I wouldn't shy away from using the terminology of your field. So in this case, medicine or any other field, because aside from our office staff, there are a ton of policy experts who help us turn like regular language into bill language, which are two very different things. And they're really knowledgeable about. So, I'll be silly for a second. A good friend of mine from college, his dad was a cardiologist, and he would talk about having a myocardial infarction, right? Which everyone else, that's a heart attack. If you're not in medicine, specifically cardiology. And I think that is perfectly okay if those are the tools that you have to communicate with us, because we know who to ask. And many of us will just ask for clarification, can you dumb it down for me? You know, speak to me like I'm 9, if we need that clarification, and that is okay. I think the really important thing is getting is communicating with us, so then we can be making effective policies, and policies that make sense, because sometimes, like, we have an idea and we write something, and when it comes to actually, and there are times this has happened, right? Something gets written, it gets passed, it sounds great, and it goes and gets signed, becomes law, but then in reality, it doesn't do the thing that it was we set off thinking it was going to do. So that's why we need that input from as early as humanly possible, so that it does, so that the very issues that as professionals you're seeing, as things that you're hearing from your patients, that as patients that they're experiencing, whether or not our policies are actually effective and useful. And sometimes, you've got this language that looks great on paper in black and white, but it's hot garbage, to borrow the phrase of a colleague of mine from last night, because it doesn't do the thing it's supposed to do.
Senator, guys, I am nodding my head because I've been in this field my entire career and I've spent the bulk of it in policy implementation side. Like that's the side where I'm like, if we fall off on civic engagement, it's mostly there. It's once we're on the ground, once we get into implementation, I feel like everyone just dips out. But that's when us as the implementers, that's when we need you. We need you to be watching us, watching our backs, so that if it's not performing that way that we need to, if we need to go back in and rewrite the legislation, if the executive branch needs to have additional authority to tweak something, we need to be talking to you and hearing from you of, hey guys, we know you put this on paper, but this is not what's happening in the ground, like right now as we're seeing it. And to keep us updated has been one of the keys that I have actually tried to beg for, that seems to be most lacking from subject matter experts. And so if we're thinking about like what comes next, following the bills, and then it's that implementation, Senator Geis, I think you're spot on. I want to ask you another question because you touched on something, Senator Geis, and that was having the conversation with individuals and those very personal stories. But what could close the conversation with an elected official? Like what can prevent you from engaging with an individual?
That's a really good question, especially right now in sort of the climate that we're in around conversations. Combativeness, where it's all antagonistic, can really cut off that conversation. And I say that with a little bit of a caveat, because often when people are reaching out to us, not just on policy issues, because that's only part of our work as elected officials, there's helping people navigate through state government. So the folks who need those secure social services and security networks, by the time they're calling us, they're at their wits' end. and polite has likely already gone out the window. So at least with my office team, we try to give folks a little bit of grace, hear them, and then try to get them back to a space where they can have a rational discussion. But then there are times, especially around sort of more hot button issues, where people are just combative and they just want to, they just want to attack rather than be productive. And one of the things that is necessary in this space, and I would argue in the medical field as well, is learning to parse out the difference between someone who's just like, they're in pain, emotional pain, physical pain, psychological pain, all the different forms of pain. And so that prevents them from being in a space where they can communicate well, versus someone is just wants to throw all the things at you because they can or think they can.
It's a
Um,
huge part of what we do. It's a great point, and it's even more reason for us to enter this space because we're already comfortable there. You know, I saw 16 patients in the hospital today, and not all of them were very happy, and that's okay, right? We're going to work through it together. We're going to communicate effectively. We're going to work with shared decision making. We're going to do the best that we can. But that's a huge part of what we do too. And I think for healthcare professionals to understand that you actually already have that skill set in some fashion and some training around it, as you've just laid out. Hearing you say that is actually really encouraging for me as we think about how healthcare professionals should continue to engage in this.
Thank you for that. I appreciate that.
I want to piggyback off of what Mark said is how else could healthcare professionals continue to engage in this?
So I'm going to give a couple tips, some really easy, maybe things that if you're saying, okay, well, I voted and I thank you for voting because a lot of physicians don't. And so that's a big first step. But the next, like, that's the point of this. What is the next step? So first, your national societies, your national organizations, usually if you are a member and they will have lobbyists that are, looking at the issues that are pertinent to your specialty. So that's a nice, good place to start. And you can see like on their websites, what are the advocacy issues. Sometimes they send out, there's easy click on this and you can send a letter to your legislators and the members that are even, in your own district. So it goes to people who are important and some of it's pre-scripted, but there's always space where you can tell your own story and how it's important to you and to your patients. And, like we've already heard from Senator Geis, they want to hear that. So it's important to put that in there. So, a lot of times your medical societies set it up already for you to have, good information to start and get it to the right people.
Now that the mic's on you, I want to ask you another question. It is somewhat related. Because I want to go back to, you have testified, you have sat at that table, you've had all the lights and all the cameras and everything on you. When you were doing your testimony, how did you prepare and did you rely on storytelling?
Yeah, so it just depends on, I've done it a couple times and sometimes it's like you had way advance notice and sometimes it's like, can you do this next week and fly to DC? And it was like, okay, I'll do it. And there's a couple steps to it. First, they want, beforehand to have a written testimony. So they have an idea of what you're going to say. And this is something that, you have up to 10 pages that you can write in your written testimony. But guess what? You only have 5 minutes to talk and they will cut you off after those 5 minutes. So there's no way I'm reading a 9-page typed out document that has a lot of the science, a lot of references, a lot of the things that I'm going to be touching on with less stories. And then I have to turn 9 pages into 5 minutes, which is not even a page, or less than a page, and make that impactful for the members that are going to be in there. So that is like, I have to take the science knowledge and make it story, make it seem very important with giving numbers and data and research, but knowing that they have the big 9-page thing to, go back to, but telling them something that will make them want to make a change. And at the end, give them the action thing to do. So this is what's happening. These are the numbers. This is what happens to my patients. Oh my gosh, my patients with long COVID, their fatigue's 100 times worse than when they had cancer. And people understand like, oh, cancer and how fatiguing that is. And now it's 100 times worse, And then I say, well, guess what? There are still 3 bills, this one, this one, this one, and we want you to act on them. And so and do it in 5 minutes and practice a lot beforehand.
Thank you.
You're welcome.
If I can add, and granted, I'm not in DC, I'm in Michigan. But as someone who's been on that other side of the table listening to testimony, definitely practice, but also know a bit about the districts of the folks, because who's on the committee is listed, like who you're testifying in front of. Anticipate those questions because and anticipate the hard questions. So that way, when you get the question that is completely off the wall, you're not shaken by it. You're ready for it. And as concise a way as possible, because you will get them and you'll also get friendly questions. Those are always easier to answer, right? Be prepared with those answers. And remember too, that like most of us, we get up the same way, we need our coffee or our tea, and we're just regular people. Like, don't be afraid of us just because we have a fancy title in front of our names. And I think when you remember that, then it makes testifying, which is scary even when it's your bill and you're testifying with your colleagues, or in front of your colleagues. It's just something to keep in the back of your mind, because then it makes it less nerve-wracking, because there's some folks who can smell the fear, and it won't be quite as easy. So, and I hate to be the bearer of potentially bad news, but it's something to be I want folks to come as prepared as possible. As a teacher in me, I think, to be as prepared as possible, so that they have as successful a testimony, a hearing as they can, because that's one of the things that can help make or break its advancing out of committee.
Mm-hmm. Alchemy, does staff help individuals prepare for their testimony, and can they, and how might they if they do?
Yeah, so typically from my experience, we did help witnesses prepare for their testimony, namely if they were a primary witness. So if they're maybe the sponsor of the bill, and we're working together on that bill together, then we would coordinate our talking points and make sure that we're hitting on the same, if not complementary points. In terms of constituents reaching out and asking for help, I don't quite remember that happening very often. Typically, they didn't necessarily come with talking points. It was more of just a story that they were telling. But the ones that did come with talking points, they didn't reach out. They kind of had it down pat. So I hope that answered your question.
That does. That's very helpful.
I think the staffers are really great at preparing me, or at least like telling me this is what we're going to talk about. This is, these are the big issues. And so I kind of already knew what I had to focus on, but I put it all together.
Yeah. Oh, thank you. All right. So not everyone gets to testify before the legislature. Not everyone's going to be able to have, that opportunity to sit with the folks and look at them on the dais and have the cameras on. But Mark, sometimes they could come to a podcast and talk to you. And it's a couple of things. How do folks get traction to have airway for a show like yours? And how could they share their story with you so that they can speak to a broader audience and in an authentic way?
I think that the word that you used right now is a really important one, right? Authentic or authenticity. It can easily be heard as a platitude, right? It gets thrown around a lot, but if we really kind of dig into what does that mean, and that's for each person to sort of do their own inventory around of what is my intention? What are my goals? What is the way I want to structure this, right? There's the nitty gritty, there's the technical aspects, but I think more from that strategic viewpoint of what do I seek to accomplish with this, and who do I seek to learn from, elevate, argue with, whatever you like to do in whatever format you want to do it within. I think that's the key thing. And then just remember, it's allowed to change. When I started Explore the Space podcast in 2015, it was not what it is now. And that's great. I'm excited that it's evolved. I'm excited that it's a place where I get to learn more than anyone else, because I get to talk with the person that I'm interviewing. And then I think it's just thinking about what is going to be your style. I've gotten feedback from people who've been on my show that I'm actually a very challenging interviewer because I don't script anything. We just jump in, and you say something cool, I'm going to pick up on it, and we're off. That works really well for me. That feels authentic to me. It's very kinetic. It's very agile. But I think it speaks more to, as you seek to build your own message platform and help others share their message on your platform, do it in the way that is authentic to you, because that makes it sustainable. It makes it more entertaining. It makes it way easier to replicate. And it just makes it more fun for all parties involved. And people can pick up on that, right? If there's positive energy, if there's enthusiasm, if there's movement and it's crackling, everyone can pick up on it. And then it will hopefully get some momentum and spread.
Thank you. And I want to follow up because you've also hosted elected officials on your show. How do you craft a way that an elected official knows that your podcast is a safe space?
That's a really, really good question. I think that in that context, it's clear why we're doing it. What is what is the situational awareness, right? Is it the election is coming up? Is there something that they want to promote? Is there something outside of their elected work that they want to talk about? So I've had Congressman Thompson on Explore the Space podcast to talk about Rock the Ride, which is a fundraising event for gun violence prevention in the wake of a mass shooting that occurred in Yountville, California. I've also had him on to talk about the run up to the 2022 midterms. And then I've had other elected officials on in that similar space. I think as the person who wants to speak with them, just as you would if you saw them at an event, where are they, as the senator pointed out, right? Have an understanding of where is this elected official coming from, both as an opportunity to learn. I think it demonstrates respect for the office, and then also understand what you're trying to do fits in with that. It takes a bit of effort. It takes a level of rigor that may not happen necessarily if I'm having a friend of mine on to talk about something to do with pop culture. And I think that's really important because we are talking about an office, and I think that the office deserves that level of respect and it deserves that level of sort of academic rigor. And then from there, they're a person, right? As the senator said, if they're another person, give them room to speak, don't interrupt, let them have some rope and run with it and have some fun. Challenge them if it feels right, and make it fit with the rhythm, tone, and tempo of the way you like to converse too, because once again, the people who are listening will pick up on that and everybody gets to shine.
Mhm. Thank you. I'm looking at the time. I want to leave some space. And does anyone have like any burning thing they want to follow up on before I ask for open questions from the audience? No?
Oh, I forgot
Yeah.
about, so also saying another way to get engaged is that if you're in academia or you're in academic medicine, or even if you work in a hospital system, every major hospital system, every academic institution has government relations offices. And so you can go to that office if there's something that's really, you think you're an expert on, that's a burning topic. They may already, they may be able to connect you with, one of the local officials that are in that district or that you serve, that your hospital serves. They have those connections. And sometimes when they have those congressmen who are visiting the institute or doing a tour, they might call you in because you had reminded them, oh, remember, I really think that brain injury is important. We need to talk to our legislators about XYZ. And so when they're there, they can invite you in to come talk to them at the institute.
Oh, thank you for reminding us about those great government affairs offices. They're there and they're knowledgeable and they're here to do two-way support. So now I want to leave some questions in time for the folks who are watching to ping any questions. I've been looking at the chat. Nothing's standing out right now, but I'm gonna give you guys all a few moments to pose a question and see what comes up, because I want to offer you guys the opportunity to get some stuff answered. Mark, I see you're coming
Alchemy a
off.
question? Can I ask Alchemy a question?
Yeah.
As a
Yes.
staffer, as someone who has worked as a staffer in a congressional office, how would you characterize the perceptions of the healthcare profession from the perspective of the elected office, particularly as someone who is the more forward facing? So when the physician, the nurse, the whomever it may be reaches out, what are the sort of like responses, biases, presuppositions?
Yeah, that's a good question. I think just thinking about the particular member that I was with, his priority was environmental things. So I landed in a good office. But I will say, yeah, I did have some interactions with the health policy sector and that particular issue area. And I will say that their position is highly regarded. There's some organizations that'll reach out and they'll be like, oh, we're interested in you supporting this bill or opposing this bill, and their particular position is regarded maybe more highly than that of others, because for several reasons. I mean, it could happen because the representative may have a good relationship with that particular organization, and that in their district, they've done a lot of work there and they've done, a lot of good work with the constituents. And so maybe there's just a really good rapport there with the member and that organization, or it could just be because that organization follows a lot of their personal values that the member may have. And so I think it really does depend from member to member. But I would say in the experience that I had, very highly regarded.
Hmm, thank you. I have a question. This is from Dr. Rohr. Hi, Dr. Rohr. She's requested a meeting with her state representative 3 times and no response. Since he's very Republican and she's in a very red state, do you think they're looking at which party she's registered with and just ignoring her?
Yeah, I can answer that. I did answer it in the chat as well, but it was kind of disjointed
Yeah.
in the response. At least for us in Michigan, we can't, when someone sends us an email, we are not immediately told what party they are a member of, or if they're even a member of a party. And the fact is, like, they're coming to us as a constituent. And technically, when we take our oaths of office, we are serving all the humans in our districts, regardless of party affiliation. And I think a good way to think about it is kids can't vote, but we're still their senator or their representative, right? So we are serving them, even though they literally cannot pull a lever or, oh man, I just dated myself, fill in a bubble. So we represent everyone who's in our district. I think in most states, except for Nevada, which is unicameral, you have a representative for your district, you have a senator for your district. So, and some of us work more in tandem than others. Like right now, currently, there are 6 state reps who are within my Senate district, and I try to work closely with them. And sometimes if there's something our office can't handle or we don't have the capacity to be able to do, we'll share that information with one of the rep that's in whichever municipality their our co-constituent lives in. So if you can't get a hold of the rep, try the senator, depending upon what that issue is. So I would keep trying, but there really shouldn't be an ability to tell who you are party-wise when you contact us.
There's a follow-up to that one, and it's about timing, so if you set up a time for the elected official, do you have to do it when they're not in session? Like your session just ended last night. When's the best time to set up a time to meet with your official?
So it depends on how you're defining in session. So there is the legislative session that starts January X and ends December Y, depending upon your state constitution. So right now, while we are not in legislative session, if a constituent needs something from our office, we are still there until 11:59 p.m. on December 31st. For the residents who, because of reapportionment, for the residents who I will still be retaining, they can contact me January 1. But for the new residents, they would contact whoever their new person is on January 1. Just because we are not in legislative session, we're still available. Our office teams are still available. But if it's during the times that we're actually on the floor voting, that's not an ideal to try to set up a meeting with us. And those schedules are public. So you'll be, and we have amazing teams of staff that we work with who will be able to say, no, the senator or the representative is in committee from X o'clock to Y o'clock, but can meet with you around those times. So that's something to consider when we're talking about in session. We use that word so loosely in this business, but so while I'm not in session right now, if someone emailed us tomorrow and was like, I need help with Medicaid, and we would be able to do it.
Mm-hmm. You would support. There's a follow-up question, and I'm going to hope I get this right, Dr. Barrett. And they would love to hear your thoughts on encouraging peers on moderating their messaging without being soul crushing. I think this gets to that combative piece, maybe. Hopefully I'm interpreting that question correctly. How do you help a peer? So I'm thinking this is Dr. Barrett and another hospitalist or a medical professional. How do you help your peer moderate that message? So when they're speaking out loud, they're not, being combative or doing too strong of a push, but in a way that they can actually be seen and heard from the staff or the elected official or whomever they're speaking in front of. Go ahead, Mark.
I might suggest, just from a practical perspective, this kind of gets back to practicing and honing your pitch for anything. And so using strategies that you would use for anything else to present an idea, I think are super helpful. So some of the things that I've invited people to do when they've asked me about this: record yourself and play it back. Listen to yourself and try to be as detached and objective as possible. How might this come off to someone who doesn't know me well? Have somebody else listen to it, right? Pitch it to me, pitch it to Stella, pitch it to Monica, pitch it to Alchemy, and see what they say and get their feedback. If you actually say, like, I'm going to meet with my elected official on December 22nd at 1 p.m., you got 2 weeks, right? So practice, hone it, think it through very, very carefully. Don't miss that opportunity and kind of come in there half-cocked. If it's going to be something that just comes up because you see them out and you feel like it's the right moment to go up to them, still, if you've thought it through and practiced, just as you would for any other type of pitch, I think you're going to feel much better equipped to present in a way that is respectful of all of the things that sort of need to be respected, but also still authentic. And you can kind of come with your whole self and walk away feeling whole around the experience.
And I'm going to go back to, making it something that's pertinent to them. Sometimes I will, if I am in DC, we'll make stops by, different offices, and it has to be something that's pertinent to them and to their constituents. So if there is someone that's a rep and he is, also has part of his area that's the border, but then I say, this is what's happening at the border. This is what is happening to, your members there. And then they will, oh, what's happening to my members? How is this going to impact my members? And they'll listen more. And then, the quote, honey catches more flies than vinegar. So you kind of have to be sweet.
As my grandmother would say, stay sweet. Alchemy.
Yeah, I just wanted to make just a comment, as now with my lobbyist hat on and not my staffer hat on. But I think that something that is pretty effective is, one, I'm going to say this with a grain of salt, but come with facts. Come with the facts. And I would say, in a non-computer, non-robotic kind of way, cite your sources, right? Like, if there is a piece of legislation that you're trying to get changed and you're referring to that piece of legislation, it's helpful to say, this bill that the legislature passed and the governor signed in this year does this. So that way the person that you're speaking to understands, like, okay, yes, maybe this was before my term, I'm not sure, but I can see now, why you're bringing this to us, why this is such an important issue. I do say not to sound like a computer though, because it's difficult. And like Mark was saying, the way that you type and the way that you speak may be a little bit different. So you want to read it out loud and read it to somebody else. And like, did I sound weird? Did I sound natural? I think that, coming with facts and citing sources is really important and really helpful.
Oh, thank you for that one. As we, wind down, we're going to ask that you share your responses and your thoughts on how we did today. I know Stella's been dropping our survey in the chat. We want to just show you a couple of slides. Civic Health Alliance, we have some available resources that you can check out. I know one that I am finding that individuals really enjoy is our laws on how healthcare professionals, hospitals, and FQHCs can serve as civic engagement or places for voting. And so we have some resources on our website. I also want to move to and share another partner webinar that's coming up related to furthering civic engagement skills, and it's called Influence Skills. It's going to be a conversation about legislative conversations on reproductive rights. I had the opportunity about a month ago to do this training. It was superb. CM Partners and PERI are amazing. So if you have an opportunity, I would say register, because they talked a lot about what Mark was getting at today was intention, and knowing what your intention is and how to set that intention going into these very difficult conversations sometimes. Um, there's a host of ways that you can stay connected to us. We're on Facebook and Instagram and Twitter. And though our handles are available, I think next slide, please, Bob, as well. And finally, I just want to tell you, thank you for joining us. I want to thank this esteemed group of panelists. I couldn't have done this without you. It has been a pleasure. I hope that our audience was able to get some really good nuggets to take away, and we'll follow up with a recording afterwards. Thank you so much for your time, everyone.
Thank you.
Thank you.
Thanks for having us.
Thank you very much.
It's been a pleasure. Basil, can we stop record? If we can.